All right, thank you, Kathy. And welcome everyone to our first session of today, which is a life course lens on housing literacy and monetary behavior. And we have four fantastic presenters from around the world. And so what I'm going to do is introduce our speakers in advance. I'm going to tell you a little bit about them. They're then going to present, and we're going to save questions until the end, at which point we're going to have about 15 minutes for your questions. So first we have Loon Lee, who received his PhD in 2021 from the University of Chicago and is currently an assistant professor in the School of Economics at Peking University. And his research interests include consumption, inflation, advertising, and the digital economy. Second, we're going to have Hiroki Uematsu, who is an associate professor in the School of International Relations at Ritsumeikan University in Kyoto, Japan. His current research focuses on understanding why poverty persists and on the measurement of poverty and inequality. Prior to returning to Japan in 2022, he worked as a poverty economist at the World Bank Group for 10 years, starting in 2012. Next, we have Jacquie Bachand, who is a government researcher with the U.S. Department of Housing and Urban Development, Office of Policy Development and Research, HUD, PD&R. And at HUD, Jacquie leads in-house research initiatives focused on housing as a social determinant of health, using data linkage approaches. A recent focus of her work has been on quantifying unique health characteristics and social needs of HUD-assisted older adults. And she holds a master's degree in public health from Yale School of Public Health and her BS from Bucknell. Then finally, we have Anthony Traver, who is a doctoral candidate at the Ohio State University College of Social Work, and his scholarship focuses on the manifestation and resolution of housing insecurity in later life. So we're going to begin here with Loon.
Hey, thank you for the great introduction. It is my great honor and pleasure to be able to present my work, joined with Professor Xin Liang at the Southwestern University of Finance and Economics. Again, my name is Loon Lee, and I'm an assistant professor of economics at Peking University. So today, the topic we're presenting is MPC heterogeneity and the age profile evidence from China. So what do we mean by MPC? MPC is a shorthand for the marginal propensity to consume. It is a very important measure in macroeconomics, as it basically measures the amount that consumers spend out of an additional unit of income. So there are many factors that determines the magnitude of MPC. For example, in this survey paper in 2010, the two authors basically just explains if the income consists of both persistent and transitory component, then the different components will have different effects on the change of consumption. So imagine if your income increases for $1 for the rest of your life, of course you're probably going to change your consumption by around $1 for the rest of your life. But if that increase is only temporary, you're probably not going to change your consumption by a whole lot. So this is measuring MPC has always been a pretty difficult task, but I'm about to show you that using a panel data set from China, we're able to kind of first estimate the MPC and how it varies with age, also construct a theoretical quantitative model to kind of match with the MPC profile. So also MPC can be interpreted as a measure of how consumers can insure against income shocks. For example, in this paper by Kaplan and Violenti, they basically interpret MPC, given the interpretation of MPC as a measure of self-insurance against income shocks. So of course, MPC is not going to be the same across all different households. There are some recent studies in macro that studies the heterogeneity of MPC across different households, but mainly these studies have focused on one parameter, which is the level of liquid wealth. So in another paper by Kaplan and co-authors in 2014, they documented the existence of an interesting group of people where they have very low level of liquid wealth, for example, cash or savings account balance, but they have sizable amount of illiquid assets such as housing or retirement account. So they document that for these households, they actually have very high MPCs. So their consumption responds very significantly to and change in income. So even though they are wealthy, they behave as though they are kind of budget constrained. So the authors named them the wealthy hand-to-mouth agents. So to understand, so the significance of MPC is also important for determining and predicting the effect of fiscal and monetary policy. So in our paper, we want to switch our focus and turn to another important dimension, which is age. It is like for a lot of the previous literature, they mainly focus on the level of wealth or liquid wealth, and very few of them focus on how age affects MPC. So the structure of this paper is that we first use a panel data to estimate the age profile of MPC. And then we constructed a Iagari type model, which is the standard workhorse model in this type of literature, and calibrated model to kind of match the age profile of MPC. I wouldn't have time to go through the model, but it's all in the slides for a reference. So the advantage of constructing this model is that it allows us to do to study the quantitative effects of MPC based on some counterfactual scenarios. For example, what if the Chinese economy or the Chinese population started aging rapidly? Or what if there's a new legislation delaying the age of retirement, which is actually what's happening in China right now. So that's kind of the structure of the paper. I'm just going to quickly skip through the literature review and describe the data source. So the main data source that we use is called China Family Panel Studies. It is openly accessible, nationally representative, longitudinal survey of Chinese communities, families, and individuals. It is launched in 2010 by another institute of the same university that I'm working in. So we select all the households that entered in the first wave of this panel studies, and basically selected all the households that stayed until 2020, who also report positive amount of income and consumption. There's some zeros in these self-reported income, and that leaves us a total number of around 1,600 households. So this is a table of the summer statistics. You can see that basically over half of them live in urban areas, and the per capita income for each household is around 24,000 yuan, which is between $3,000 to $4,000. And for the households, total household expenditure is around 55,000 yuan, which is around $6,000 to $7,000. So the main estimation approach that we use is following a Euler equation approach, such as that is used in two previous papers. So the main idea is that we took the first order difference log consumption and regress that against the first difference log income for each household. And we also include other household level characteristics and counting and year fix effects. So the main idea is that this is going to give us the estimate of the income elasticity, basically how much of a 1% increase in income brings you changes in consumption. It is not quite MPC yet because we have to multiply that parameter by the average propensity to consume, which is just consumption over income, to get basically the partial derivative of consumption with respect to income. So overall, our baseline result is that we found that MPC is around 10%, 0.1, which is consistent with other people's, for example, this Jonathan Fisher's paper in 2020 using PSID data. So Chinese households, in terms of their consumption and saving behavior, on average, looks pretty similar to US households. So this is the main regression table. We try different regression methods between full OIS or with different controls or county and households fixed effects. The main coefficient is pretty robust. So another thing, the main contribution that we did is that we also estimated the age profile of MPC. So basically, we included this interaction term between the first difference, log income and age. So that allows us to provide an estimate of the income elasticity for each age. And then we multiply that by the APCs of each age group to get a age-specific estimate of the MPC, which is plotted in here. So you can see that along different point in age, Chinese households behave very differently in terms of their marginal propensity to consume. In their early 20s, the marginal propensity to consume is low. They started saving for housing and for having kids. When they approach to the age of 30 and 40, they start to have mortgage and kids, and you see that the MPCs gradually start to rise. And then after 40-year-olds, there's a downward trend of decreasing MPC. People are starting to save for retirement. The retirement age in China is between 55 and 60, depending on your gender. So after 55 and 60, you see a gradual trend of upward MPC. People are spending a little bit out of their retirement income. But then, like a more interesting fact is that towards the end of their life, we're not observing what a lot of theory would suggest, a high MPC going towards 1, because our interpretation of this downward MPC is that people are worried about their health status, the health risk related to their medical expenses increase. So that's partially what explains this downward trend of MPC. We also did that by health and housing status, as I'm going to show you in next slides. So this is kind of interesting because we see that for households basically for households head who self-reported a health status of good, the MPC is the highest. Who self-reported medium, the MPC is lowest. And for households who have poor health, the MPC is in the middle. So our interpretation of this is that when you're in good health, you're not really like aware of the potential risk related to health. You're not doing a lot of the precautionary saving with respect to the health shocks. But if you're like in a middle health region, you're kind of saving a lot for the potential medical expenses related to your health status. Now, if you're in poor health status, there are a lot of mandatory expenditures that you have to make, for example, buying your medication and going to the hospital. So that explains, in some sense, the higher MPC for poor health individuals than the medium health individuals. So we also did a graph by housing. So we see that for people who own the entirety of their houses, the MPC is the lowest. For people who are renting their houses, especially in their early 30s and 40s, the MPCs are very high, indicating that they have a very more volatile consumption towards changes in income. So I'm gonna for the sake of time, I'm just gonna skip the entirety of the model and just go straight to the results. So basically, this model is not our main contribution. It's pretty standard in the literature. It's a model with a earning-related pay-as-you-go pension system. So we calibrated this model, and one of the main features is that we allow the income process to be age dependent. So the previous problems with a linear income process is that it has to be age independent, but we kind of break that assumption and allow basically a 20-year-olds to have a different income process than 40 or 50-year-olds. So we match that with the data, and here is how we fit the model. So the yellow curve is the MPC profile from the data, and the black curve is our model. So overall, I think we did an okay job describing both the aggregate level of MPC as well as the whole profile. We're still trying to improve the model fit, but as I said, having a model allows us to study the effect of, for example, what if you delay the age of retirement from 60 to 65 years old in China, and you see basically a whole shift of the MPC age profile towards the right. And another example is that we ask, what if the population structure in China right now is suddenly becomes the predicted population structure as in 2050? So the yellow line is the counterfactual MPC structure in that case. So the reason why the young people have very high MPCs is that they have to pay for the burden for the pension system. So their budget is much tighter. Therefore, they have a much higher MPC than the baseline case. So this is pretty much it. We're for the future work, we're also working with some proprietary microdata from the National Bureau of Statistics in China. We're hoping that we can have a better estimate of the population structures in the future so that we can have a more realistic estimates of the age profile in different cases. So that's pretty much all of my research. Thank you very much.
Good morning, everyone. My name is Hiroki Uematsu. I'm Associate Professor in the Department of International Relations at Ritsumeikan University in the city of Kyoto, Japan. Thank you very much for having me for this session. And the topic I'm going to discuss today, I'll be honest with you, it's going to be extremely simple compared to all the presentations that you have seen so far, including yesterday. But it's something I'm sure is close to the heart for almost everyone in this room, which is about education and literacy in particular. The objective of this study is for us to think about how best to measure adult literacy in light of the SDGs framework. SDGs, as we all know, promises that we should leave no one behind when it comes to the effort to educate and provide basic literacies to anyone in the world. I'm going to skip through some of the slides in the interest of time. SDG 4, Quality Education for All, states that we should ensure that inclusive and equitable quality education and promote lifelong learning opportunities for all. In particular, under SDG 4, there is a target SDG 4.6, Universal Literacy and Numeracy, which states that by 2030, ensure that all youth and a substantial proportion of adults, both men and women, achieve literacy and numeracy. When it comes to adult literacy, the way adult literacy is measured is this. The proportion of the population who is literate among those people who are 15 years and above. If you look at the global trend in literacy, this looks like a massive, significant improvements over time since when we have the data on literacy at the global scale. About back in 1976, about 1/3 of the adults were considered illiterate, and that number has decreased all the way down to 13% by 2021. The latest year we have the data on literacy, adult literacy at the global scale. I would argue that this graph, this indicator is one of the most misleading statistics that you can find when it comes to adult literacy. And I'm going to explain why. And I hope this is going to be an opportunity for everyone in this room to think about why that is the case, or if you would agree with me or not. And I hope this is going to be an opportunity for us to sort of stimulate discussion around how we should think about literacy on a global scale in light of the SDGs principle. One of the reasons why I think it's extremely misleading to report the share of adults who is literate or not is because of this. If you simply look at the number of people who is literate and not literate, there is not much change when it comes to the number of illiterate adults over time globally. Back in 1975, about 0.9 billion, so 900 million people were considered illiterate. The number has been pretty much stable all the way until now. In 2021, we have about 800 million people who is still considered illiterate. So much of the improvements in literacy over time is explained by the fact that the younger generations happens to be much more educated than the previous generations. Another reason why I think it's misleading is this. There is tremendous regional disparities when it comes to literacy. As you can see in this graph, the literacy rate has been increasing over time, as we mentioned, as you can see on the right, but there is tremendous regional disparities. you see that in regions, especially two regions, South Asia and Sub-Saharan Africa, even though the literacy rate has been improving even in these regions, the fact that the population growth has been so fast, as you can see in the movement to the right horizontally, means that the number of illiterate adults has been increasing in these two regions in particular. Another reason why I feel the literacy is misunderstood is that literacy is strongly correlated with age. This is a sample population pyramid that I constructed from the IPUMS data on Senegal 1998. I took this example from Senegal, but many of the countries share similar features. This is a population pyramid that may be a little bit different from what you're used to, in the sense that I divide the population into literate population and illiterate population instead of dividing it into male and females. And again, throughout this presentation, I color literate population by blue and illiterate population by red. And in this case, you can see on the left of the pyramid, a big bulge of young population in blue, meaning that younger population tends to be much more educated and much more literate. On the other side, on the other hand, on the right side of the population, you see that the red, there's a lot of spikes in this age distribution, in the sense that this is the phenomenon called age heaping that we often observe in population census data. Age heaping is a phenomenon where a lot of people in not so literate society do not know exactly how old they are. So they tend to report ages that ends with specific excuse me. They tend to report ages in specific digit, like 0 and 5, ending with 0 and 5, for example, 25 years old, 30 years old, 35 years old. The fact that we see much more age heaping on the right side of the population pyramid means that there is definitely an issue of literacy in this population pyramid as well. We can also look at the correlation between age and literacy in another example here. This one also from IPUMS International. I'm taking the example from Malaysia. Malaysia happens to have two different data points that's almost 30 years apart, 1970 on the top row and the 2000 on the bottom row. Each square represents the entire population of either female or male in either 1970 or 2000. On the top left corner, that's the female population in Malaysia, 1970. You can see, and what's measured on the horizontal axis is not the age, but the year of birth for each respondent in these census data. You can see that as you look at the graph vertically, there is a little bit of a gap between 1970 and 2000 in the sense that, of course, in 2000, there are certain people who do not exist anymore that was actually present in the previous sample in 1970. And then you can also see that the older generation tends to be much more red, meaning much more illiterate, and the younger generation tends to be highly more educated than the previous generation. For all these reasons, I would argue that the adult literacy rate that's traditionally reported in the SDG framework can be extremely misleading. Adult literacy rate can be affected by not just the true literacy gain among those people who didn't have a chance to learn in their childhood, but it can be affected by a whole bunch of other factors, including cohort replacement, meaning that younger, better educated generation is simply replacing older, less educated generations who is basically going out of the age bracket, meaning they are passing away. It can also be affected by population dynamics, mortality, migration, in addition to the true literacy gain that we should be interested in measuring. In fact, there is a paper written on this very specific topic by Barakat in 2016, published in World Development. It finds that much of the increase in adult literacy is due to cohort replacement. Again, younger generations, much better educated, are simply replacing less educated elderly people who are going out of the age bracket. In this study, they found that very little literacy gain actually happens among illiterate population in their adulthood. This sounds quite depressing. What's more depressing is the fact that we really do not know. As far as I know, I have never come across any official statistics or any estimates that actually shows how much true literacy gain took place among those people who didn't have a chance to learn in their childhood. So I managed to do a simple simulation just to have a sense of how much there was actually some true literacy gain when it comes to when it comes to the adult literacy rate. So this is the data in 1976 and 2016, so 40 years apart. On the left, we have literacy rate of people who are 25 years or older. There were about 1.8 billion people, and then about 700 million people were considered illiterate at the time. In 2016, 40 years later, I managed to find the literacy rate of people who are 65 years old or above, meaning they are the same cohort of people, except that there are a lot of people passing away. I only have 3 minutes to go. This is all, still halfway through my presentation, so let me just skip through some of the things. But what happens here is that if I assume certain level of true literacy gain among those people who didn't have the chance to learn in their childhood, what happens is that the mortality rate among those illiterate people and literate people are almost impossible. We have much lower mortality rate among the illiterate people if we assume certain level of true literacy gain among the illiterate. So what happens is that perhaps the most optimistic scenario where we can assume certain level of true literacy gain among those people in the red on the left side of the graph is perhaps around 5 to 10%, which is quite depressing in the sense that if you didn't have a chance to learn how to read and write, the chances of you learning that skill later in life is extremely small. About 1 in 20 people, 1 in 10 people can learn how to read and write later in life. And this is extremely concerning in the sense that in an increasingly aging society, the illiterate adults also have much longer years of life to recoup investments made in gaining literacy and education, yet they tend to experience much longer years of life without having this ability to read and write. So I propose that this is the time that we have to rethink the way we measure and define adult literacy to address the misconceptions and the actual reality of what's happening around literacy. We tend to think literacy rate, hey, we just count the number of people who can read and write and count the number of people who cannot read or write. In this example, 5 people, 2 out of 5 can read, 2 out of 5 cannot read, so 40% literacy rate. Equal weight per person, that's what we are implicitly assuming. But what if these people have much different the age profiles? Then what's happening here is like this. And then in case you can measure the literacy in terms of person years, the picture looks quite different from what it was before. We have 150 years of illiteracy out of 250 total years, and the 60% literacy gap once you place equal weights per person year instead of equal weights per person. This gives us a much different picture of understanding the state of the literacy. In fact, this is a similar idea that exists in the poverty literature. When we measure poverty, I will skip through. But in case I started looking at the total number of years without literacy in many of the countries that we can estimate this indicator in the IPUMS international data set, we see that despite having an increase in literacy rate, the total number of years without literacy is also increasing, which is quite different from the trends that we find in poverty. In poverty, we see that poverty is declining, and then the depth of poverty is also declining. In the case of literacy, literacy rate is improving, but the depth of the gap in literacy is actually increasing over time, which is quite depressing. Of the 30 episodes in 19 countries that I have analyzed, I have just shown one example from Uganda in the previous slide. About 23 episodes, so an increasing total years without literacy. At the same time, they also experience increase in literacy rate. And the same numbers, 24 episodes out of 30 episodes for females, and 21 episodes for males out of 30 possible episodes. This is the last slide. Again, to summarize the discussion so far, In many countries with declining adult literacy rate, total years of life without literacy is actually increasing. In addition, women experience much longer years of illiteracy on average than men do. We have to change the way we think about the literacy. We cannot just afford to continue to measure literacy by simply counting the number of people who can read or write. We need a new way of measuring and monitoring adult literacy if we truly believe in the SDGs principle of leaving no one behind. In case you're interested in the visuals, I prepared everything online. This is optimized for computer screens, but all the visualizations are available via the link from the QR code or the link on the bottom. Thank you very much.
Okay, sorry. Hi, everyone. My name is Jacquie Bachand, and as Andy said, I'm an analyst in HUD's Office of Policy Development and Research. Before I get started, I wanted to acknowledge two of my colleagues at HUD who helped with this work, Veronica, Helms, Garrison, and also Katina, Norwood. And then I also wanted to state that the findings that I'm sharing are those of my own and not necessarily the position of HUD. So first, I want to orient everyone to HUD for those who aren't familiar. HUD is a medium-sized federal agency that oversees the nation's housing and community development policies. One of HUD's main goals is to provide affordable and safe housing for all. However, unfortunately, in the U.S., housing isn't an entitlement, and only a quarter of those eligible actually receive housing assistance. So this equates to HUD able to serve and give folks housing assistance for about 9 million individuals in 4.6 million households. And then approximately 40% of HUD-assisted households are headed by a person or spouse age 62 years or older. HUD has a number of subsidy programs, and they all provide the same basic function of providing a monthly subsidy to make housing affordable to primarily extremely low income households. So HUD's assistance programs can be broadly lumped into two different categories. First, we have project-based, where the subsidy is tied to a physical unit, and then we have tenant-based, in which the subsidy is tied to the household. The two major programs that are project-based are public housing, which is federally funded and regulated, but managed by local housing authorities, and then the multifamily program, which is a contract, which is essentially a contract between HUD and development owners. Examples of the multifamily program are project-based Section 8, Section 202, which caters to older adults, and then Section 811, which caters to folks with disabilities. And then HUD's largest housing assistance program is the Housing Choice Voucher Program. And in this program, households receive a voucher where they can rent on the privately owned rental market. So HUD data is collected through two different forms, the 5058 and the 5059. Project-based housing programs are collected in the 5058, and then the tenant-based housing program is collected in the 5059. Both of these data sets are very rich data sources that contain information on the respective HUD program, in addition to individual and household level characteristics, income, and also geography. So in addition to having its own administrative data source, HUD has its data linked to a number of different data sources. And then one of the most premier, in my opinion, in the health and housing space is the HUD NCHS data linkage. And this data linkage is the result of an ongoing partnership between HUD and CDC's National Center for Health Statistics. As a part of this partnership, HUD geocodes the NCHS data, and then NCHS performs the linkage. And we have two national health interview surveys linked with HUD data. We have NHIS and then NHANES, and then the currently available data through this linkage is NAHIS and Haynes data linked through 2018, and then HUD data linked through 2019. So in 2017, some of my colleagues at HUD published the first A Health Picture of HUD-Assisted Adult report. And after the data linkage initially became available, this report was the first to provide nationally representative estimates of many health outcomes of HUD-assisted adults, and then two comparison populations. One is unassisted low-income renters. These are folks who have incomes below the federal poverty threshold, and they didn't link to HUD, but they are living in a rental unit. And then we also compared to the general adult population. So the work that I'm presenting today is building upon this initial report, but it's specifically focused on older adults. And the initial report is using 2006 to 2012 data. This data is 2013 to 2018. So the first thing that we looked at is we wanted to see what was the proportion of HUD-assisted folks in the different HUD programs. This isn't surprising, but about 50% of HUD-assisted folks are in the multifamily housing program. The reason why this isn't surprising is that for those who know, Section 202 is HUD's program focused on older adults, and that's a multifamily housing program. And then we also looked at a number of socio-demographics. In terms of socio-demographics, we found that HUD-assisted older adults have distinct characteristics to their comparison groups. Compared to the general population and other unassisted low-income renters, a significantly greater proportion of HUD-assisted older adults were women folks over the age of 74 years old, non-Hispanic Blacks, people who were single, mostly widowed, divorced, separated, or never married, and then lived in the Northeast and had never worked. Many of these findings, including sex and race ethnicity, are consistent with those found in the literature for the HUD-assisted population. So we also wanted to look at older adults by health interview survey language. As you can see, the far majority of folks use English as their survey language, but we were interested that HUD-assisted and low-income renters had around 12 to 13% of persons who completed their interview in Spanish. And then we were also intrigued by that 7.6% of HUD-assisted older adults who reported their interview language as other. And then we also looked at family type by older adults. As I mentioned, the majority of HUD-assisted older adult persons were single, and this is matched with this family type variable where HUD-assisted have a very high proportion of one adult households with no children, which is very different from the general adult population where they have a greater proportion of folks with the partner and no children. And then we also looked at a number of health status variables. HUD-assisted adults reported lower self-reported fair and poor general health compared to the general population and other unassisted low-income renters, meaning that they generally reported higher rates of health. And then we also looked at ADLs and IADLs, which is activities of daily living and then instrumental activities of daily living. Difficulties with ADLs and IDLs often correspond to how much help, supervision, and hands-on care an older person needs. So in terms of activities of daily living, examples include bathing or showering, dressing, getting in and out of bed or a chair, walking, using the toilet. And we found that there was a significantly greater proportion of HUD-assisted adults who reported difficulty with ADLs. And then we found a similar trend with IADLs, which are instrumental activities of daily living. These are self-care tasks that require a little bit more complex thinking, such as using a phone, shopping for groceries on your own, or planning and serving meals. And then we also looked at prevalence of serious physiological distress among older adults. As you can see, HUD-assisted and low-income renters had similar rates, but they were both greater than the general population. And then lastly, we also looked at a number of healthcare utilization variables. We found that HUD-assisted older adults have higher rates of usual source of care compared to other unassisted low-income renters. And as you can see in this graph, HUD-assisted older adults have comparable rates of usual source of care to the general population. And we suspect that this is because a lot of HUD-assisted adults are tapped into the social safety net system. I'm not showing this data, but also compared to unassisted low-income renters, HUD-assisted older adults also had higher rates of food stamps and health insurance. And then we also looked at the proportion of older adults experiencing delayed care. As you can see, HUD-assisted older adults reported lower proportions of delayed care compared to low-income renters. But we also looked at ER visits, and they reported a higher proportion of 2+ ER visits compared to the general population and other unassisted low-income renters. So in terms of takeaways and next steps, I think that this study kind of reaffirms something that we already know, that is HUD-assisted HUD-assisted adults, including older adults, have distinct socio-demographic characteristics. Most are women, live alone, and are unsurprisingly in the multifamily housing program. We also found that although HUD-assisted older adults report lower rates of fair or poor health, they also report higher rates of IADLs and ADLs, and also compared to the other unassisted low-income renters, a greater proportion of HUD-assisted older adults have a usual source of care, and a reduced proportion have delayed care. In terms of next steps, my colleagues and I are working on updating the health picture of HUD-assisted adults reports with 2013 to 28 data. Specifically, we want to do an older adults report, and then we're going to do the health picture of adults and health picture of children report. And then for those who are interested in the NCH HUD linked data, we are hoping that the next iteration of linked data linked through 2019 to 2022 is going to become available in winter 2025. Thank you so much.
All right, so we're going to have some nice continuation from that presentation into what I'm going to talk about today. We're going to be looking at rental assistance kind of across the lifespan. So we're looking at all ages and seeing how that has changed over time. And we're going to leverage current population survey data to help get at that. And so we're looking to model both the probability of being eligible for rental assistance by age and year, and then among those who are eligible, trying to model the probability of receiving rental assistance. So why link? Why take this approach? So some of the existing data has limitations that make this difficult. Some of that has to do with the granularity. So maybe it's limited to the household, or the publicly available versions are being released for geographies. And also we have some limitations in American Community Survey, where rental assistance is not reported for most surveys. Don't know why that Copilot preview is there, but so let's get into it. So we're going to be using the March annual social and economic supplement. So that comes out kind of once a year. Each year, we're looking at about 1,450 individuals across 90,000 households. We got that locally here. So thank you very much for making that available. Some of the data we're going to look at, and I want to kind of draw attention to this idea of family unit and family size. So those were variables created in-house by the IPUMS team And one of the reasons why that's important is because when we think about eligibility for housing assistance, we want to kind of differentiate possibly between a household and maybe multiple families in that household, maybe only one of which who would be kind of applying or interested in rental assistance as a singular unit. And we're going to be using the available weights as well. And we're going to be defining housing assistance by either the report of living in public housing or a rental subsidy. And critically to the link is we're going to be looking at the metropolitan area identifier. And the samples we'll be looking at are going to be 2000, 2010, 2023. This is going to give us a little bit of a look kind of post-housing crisis, post-recession, and then kind of the recovery since then. And when we're talking about HUD income limits, HUD creates specific thresholds to which they determine eligibility for rental assistance. And the more general one that we're going to use today is the very low income limit, which is 50% of area median income, and they're going to adjust that for family size. So we'll take that into account. Different programs do have kind of other considerations that aren't going to be captured in the analysis presented today, but certainly an opportunity for future work. Critically, these vary by geography, and so we want to be able to account for that. So using just a poverty, a federal poverty line is not going to give us the sensitivity we need when we talk about eligibility. And just for a local example of what those income limits look like, this is the most recent one for Minneapolis here. And it's a pretty large kind of multi-county region. And for our CPS data, so across all 3 years, 2000, 2010, 2023, we're going to have a little bit of a reduction in our analytic sample. We're going to only be looking at metropolitan area cases, but not all of them have the FITS code needed. We're also going to drop anybody reporting age 80 or over because there's inconsistent top codes across those samples. And then we're also dropping anyone who's reporting a family size over 8 because the data from HUD only goes up to 8. So we're left with 346,000 individuals. And for the HUD data, we're pulling that for each year, but it's going to be lagged because they're releasing their limits kind of May to May. So when we're using March, we're going to account for that lag. And in situations where a metropolitan area might have multiple limits within it, we're taking the average. We'll talk about that as a limitation later on. So we're going to be linking primarily by the FITS code, and then we have to also link by family size and of course year. And then through that, we can create kind of our important variables where we're looking at family income. So we're summing all of the individuals within a family unit. And then in this situation, there could be multiple family units within a household. So we're creating a distinct family income for each one. We're comparing that income to their local and family size based eligibility threshold. And then we can consider as a proxy for eligibility if they are very low income and renters. And then we're determining that they have rental assistance access by reporting public housing or subsidy. We're going to kind of estimate this probability in 2 ways. One, we're going to use polynomial, and we're going to use a survey weight general linear model. So that's going to help us kind of get the kind of full spectrum across all ages. And then I'm also going to break that down and treat age as categorical so we can do some explicit testing. And I'll show you the results just for older adults in this slide. We're going to use functionally the same thing when we're looking at access, but we're just restricting our sample. So this is only among the folks who are eligible. And just to kind of introduce our samples, so 2000, 2010, 2023, we do see a rise in overall VLI renter prevalence and also a reduction in assistance, which I imagine is mostly a function of kind of an economic recession and a major change in housing, especially among those with low incomes. And a look at our general age distribution for all our metropolitan cases. And so now to get into it, when we look at the probability of being a VLI renter by age, we kind of see this kind of multi-curve pattern here for the year 2000. And then as we go forward in time, following the recession, we see a rise at functionally all ages except the very top. And then more recently in 2023, we've come down from that a lot. And so I think calling out kind of from a public policy perspective, a very large reduction at the lower end. I think that's something that's very crucial, but that's also being paired with a rise in the prevalence of VLI renters among older adults. And then when we break that down explicitly, we see very different patterns by age group. And when we look over all the way to the right at older adults, we see a significant increase in the prevalence or the probability of being a VLI renter for those over the age of 62. We like that age of 62 because that's kind of what HUD considers an older adult, as we just learned. And so they do have access to specific programs. So that's why we're using that cutoff there. So we see a change kind of moving forward into 2023. So now looking at housing assistance among very low income renters, we see that the majority of people who are eligible are not receiving assistance. That's consistent with the literature, and that does tend to rise with age, and that's kind of consistent with what we just saw in that presentation. The older you are, the more likely you are to be supported through some of these rental assistance programs. Following the recession, we see a reduction in that coverage for most ages. Older adults seem to be slightly more resilient in that regard. And then as we move forward, we see kind of a partial recovery in that access piece. So that did not come all the way up for those at the youngest age, but older adults continue to gain access kind of into the more kind of recent future. We'll be looking to see kind of how that changes and probably a pattern that might continue. And so what we see here again is similar patterns for each age group, but really when you're looking at who's kind of recovered back to that 2000 level, you're really seeing older adults kind of getting back to that level and seeking to go almost beyond it. And again, we're just kind of doing some explicit tests, and we can see that compared to 2010 to 2023 is where we're seeing a significant jump in that. And so what does that really mean for us? So we're seeing both a kind of more uniform distribution of eligibility. So it's not as age dependent as it once was. And then kind of in contrast to that, among the eligible, we're seeing that distribution of access becoming less uniform and really favoring older adults over time. And that has a lot of, important implications for us as we look to kind of continue to provide relevant housing for an aging population. So looking at programs, we can really think about kind of place-based interventions that would be relevant for those multifamily projects that Jacquie just talked about, or public housing, and really probably needing to both increase the diversity and the intensity of services in order to promote healthy and aging in place. And then when we think about people who are using vouchers, and so they're renting on the private market, the need for reasonable accommodations for those voucher users might continue to be an increasingly relevant concern, and being mindful of how those requests can risk someone's housing stability in the context of a landlord who maybe is not wanting to make further investments in their property. And so kind of making sure that we're mindful kind of region to region about variations in tenant rights. And then looking from a policy perspective, we could kind of see some of these results as maybe a success when we're looking at older adults. We've seen an increased access, but what we also saw was diminishing access among children. And so that's really a big shift for the way that we used to think about kind of who was deserving of and worthy of public housing and housing assistance. And so now in moving away from children, we are kind of creating opportunities, and as many of the presentations have shown kind of throughout this week, the importance of kind of contextual factors, stable housing, healthy environments on development. So wanting to pay attention to how we might continue to expand housing assistance to address that lag. And then just to acknowledge some of the limitations. So with our sample, because we're using this linking process, we can only do that with folks who are identified in the CPS by geography. So we're missing some folks who are in rural areas. And also we've lost some of the metropolitan cases. And I want to especially call out all of those cases over the age of 80, which we excluded because of the inconsistent coding of age at the top. But that's going to be a really important group, older adults over the age of 80. I think that's going to be worthy of a lot more investigation. And then there's some measurement issues when we think about eligibility, that is often a little bit more of a complex picture than simply, are you currently renting and are you below a threshold? So we're losing some sensitivity there. And then when we average the VLI limits across metro areas, there's different opportunities to maybe weight those different areas by population to kind of create a weighted mean. That might be a little bit more accurate. Different metropolitan areas are creating different income limits within themselves for slightly different reasons. So it's kind of unclear at this point what kind of the implications are on our estimates. And then another thing I want to continue to develop is thinking about using this survey weighted regression and maybe accounting for some clustering kind of within the family or maybe even at the metropolitan level. And that's it. Thank you.